Hi everyone, Dr. Yusuf Mathai here. So, as the fall and winter months settle in, and as you can see, we are in fall, many patients tell me the same story every year. My energy's tanking, I can't focus, I just don't feel like myself. This really isn't imagined, and for a lot of people, myself included, it's seasonal and it has a name. So, seasonal affective disorder or SAD. So, today we're going to talk about what SAD is, why it happens, how we diagnose it, and most importantly, what you can do to feel better. So, what is SAD? So, seasonal affective disorder, it's a type of a depression that's linked to changes in seasons. Most people feel symptoms, late fall or winter when daylight hours shorten. And then as spring returns, symptoms typically tend to improve. So to truly diagnose SAD, you need at least 2 consecutive years of this pattern. So symptoms starting in a particular season and then resolving in another. So common symptoms, like I said, include low mood, low energy, oversleeping, weight gain, craving of carbs, social withdrawal, wanting to hibernate. So these are all symptoms. So does this sound familiar? Well, it's safe to say about 1 in 20 adults, or about 5%, may actually meet the criteria for SAD in any given year. Now, the question is, why does this happen? So, the most common theory is light exposure. Shorter days disrupt our internal clock or circadian rhythm, and less light can decrease serotonin, the feel good neurotransmitter, and increase melatonin, which makes us sleepy. So, think of your brain as a solar powered mood system. Less sunlight typically equals less power. So, good news. There are a number of proven treatments. Number one on the list is actually bright light therapy. So this involves sitting near a special light box that delivers between 2,500 and 10,000 lux of light for about 30 to 60 minutes each morning. When you purchase a light box, it'll actually tell you how many lux or units of light it produces. So you're in between 2,500 to 10,000. It's safe, low side effects, and can start helping in about 1 to 2 weeks. So it's as effective as other first line treatments for a lot of people. Okay. Another highly effective option is cognitive behavioral therapy tailored for SAD, sometimes called CBT SAD. Now, this isn't generic therapy, and so it's important to find somebody who knows what they're doing. The therapy specifically targets negative thoughts about winter, behaviors that reinforce low moods, lifestyle patterns that worsen symptoms. Now, here's the interesting part. While light therapy works pretty quickly, CBT, cognitive behavioral therapy, tends to prevent symptoms better long term. So patients treated this way are less likely to relapse in the future, which is pretty awesome. We can also use medications when needed. The one with the best evidence for preventing SAD recurrence is actually bupropion XL. It helps reduce your chances of symptoms coming back the following year. Side effects, again, to the medication might include things like headaches, nausea, trouble sleeping. Other antidepressants like fluoxetine can help too, but the evidence is less consistent when it comes to those. So, a lot of patients overlook simple habits, actually. So when we talk about other things, lifestyle support is there. So a lot of people overlook simple habits that reinforce mood. So getting outside, even on those cloudy days, natural light actually does help, right? Move your body regularly. Exercise boosts neurotransmitters. Creating social routines rather than withdrawing, and keeping sleep consistent. So don't oversleep if you can avoid it. As for supplements like vitamin D and others, well, the science is inconclusive. They don't appear as reliable as some of the other first line treatments specifically for SAD. However, when it pertains to vitamin D, we still recommend vitamin D supplementation during the darker times of the year. Not so much for SAD, but we know production tends to decrease because of decreased sun exposure, and vitamin D has numerous benefits to the body. So over the next couple of weeks, I might be making a video specifically just talking about vitamin D. So, choosing the right approach. Well, here's the nice part. Because bright light therapy, CBT, and antidepressants all show similar effectiveness in the short term, you can really personalize your treatment. Some people prefer a non-medication approach. Some want the fastest relief. Some prioritize preventing relapse next year. So really what we try and do when we're talking to patients about this is we try and tailor things, towards your goals and what it is that you want. So again, in closing, if you've noticed mood slipping every winter, literally don't write it off as just being winter blues. SAD, or seasonal affective disorder, is real, treatable. You don't have to white knuckle your way through it. Reach out, let's talk. We can build a plan together that helps you feel like yourself again. Again, I'm Dr. Yusuf Mathai with Oregon Health DPC. If you found this helpful, like this video, share it with someone who needs to hear it, and subscribe for more science-backed ways to boost your health and vitality. Stay warm, stay connected, and we'll see you guys soon. Alrighty, bye.